Hello, my name is Jody Siegel, and I'm Director of Education for Elyssa's Mission. On behalf of my co-presenter, Katie Baker, Program Director, whom you will hear from shortly, and myself, we would like to welcome you to this recorded presentation. We know that suicide is not an easy topic, but it is nonetheless an essential one. Suicide among our youth is a very real concern. However, suicide is also preventable. The best way to prevent a suicide is to educate those in your child's life, their friends, teachers, parents, about the warning signs and what you should do in the event that you're seeing these signs. Thank you for making your child's mental health a priority and for taking the time to learn what to look for in order to keep your teen or another teen in your life safe. Elyssa's Mission is a nonprofit organization based in Northbrook, and our whole focus is suicide prevention. Specifically suicide prevention in middle and high schools. The reason we got started is because of the young girl you see in the photo here, Elyssa Myers, who lost her battle with depression in 2004 when she was just 16 years old. Elyssa was in many ways a typical teenager. She came from a loving home and was a good student. She enjoyed spending time with her friends, and she had a lot of friends. She played sports and was a star of her basketball team. Elyssa was a wonderful writer and wrote beautiful poetry. But Elyssa also had depression. And as you may already know, depression is more than just being really sad. It's a serious illness that affects all parts of someone's life, and in some cases can even lead to thoughts of suicide. That's why it's critical that we talk about it. When Elyssa was in school, people were afraid to talk about suicide. They thought that if you talked about it, it would somehow put the idea in someone's head. We know now that this is a myth and that school communities need to talk about it. This is what prompted Elyssa's parents to start Elyssa's Mission. Our main focus is funding and helping middle and high schools to implement an evidence-based program called SOS Signs of Suicide Prevention Program. We currently partner with over 130 schools throughout Illinois. We'll tell you more about the SOS program later in the presentation, as well as discuss your role in suicide prevention. I want to start by sharing a few statistics. We all know youth suicide is a concern, but it helps to provide context for our discussion. Suicide is the second leading cause of death for young people ages 10 to 34, with 5,900 youth lives lost to suicide each year. Suicides are also often underreported, with many so-called accidents really, in fact, being suicides. On top of this, it's estimated that for every completed suicide, there are at least 45 attempts, with an additional 250 people seriously thinking about suicide. So when you factor those last two items into the mix, youth suicide is an even bigger concern than what the statistics reveal. But there is hope. 4 out of 5 people who die by suicide exhibit clear warning signs to family and friends prior to their death. That's why it's so important to know what these signs are, and to know what to do when you're seeing them. And we'll be talking about that a bit later. I want to start by talking about depression, and the reason for that is that depression is the leading risk factor for suicide. 2.5% of children are reported to experience depression in any given year. Before adolescence, depression is equally split between boys and girls, but by age 13, more than twice as many girls compared to boys have depression. Between 10 to 15% of teens have some symptoms of depression at any one time, and an additional 12.5% of adolescents, 1 in 8, report experiencing at least one major depressive episode in a given year. And that's the most common type of depression. There's a myth that teens can't become depressed, that they're just moody. But as I just mentioned, 1 out of every 8 teens experiences real, diagnosable depression. That's why it's so important that the adults in teenagers' lives, teachers, parents, know the warning signs and are able to help distinguish between typical teenage behavior and behavior that warrants further investigation. So let's talk about typical adolescent behavior. At this age, teens are very focused on peer relationships, and they're often distancing themselves from their parents. It's also typical for adolescents to test boundaries that are set for them. For example, coming home past curfew and becoming more defiant. Many teens become self-centered. Everything revolves around their world. and they often experiment with identities to figure out who they are. Finally, it's normal for teens to occasionally be moody due to hormone fluctuations. There's a big difference, however, between what we just talked about as typical adolescent behavior and a major depressive episode. This, again, is the most common type of depression. Depression is an illness that affects all areas of someone's life. Like any other illness, it has to be diagnosed by a trained medical professional. In order for someone to be diagnosed with a major depressive episode, they have to have 5 or more of the following symptoms, and these symptoms have to last 2 weeks or longer. These symptoms further have to represent a change from their previous level of functioning. At least one of these symptoms must be depressed mood or loss of interest or pleasure. While most of us associate sadness with depression, it's important to note that sometimes in teens we don't see sadness, and what we see instead is irritability. This irritability is much different from typical teenage moodiness. In this situation, the teen is irritable with everyone in their lives and not just their parents, and it happens consistently, every day, and for most of the day. Another symptom of depression is loss of interest in any activity your teen would normally enjoy. For example, dropping out of sports, not playing video games online, not hanging out with their friends like they used to, for example. Depression can also have physical symptoms and affect one's eating or sleeping. Some people who become depressed lose their appetite, resulting in rapid weight loss, while others might overeat, resulting in rapid weight gain. Some people with depression develop insomnia, while others sleep more than they normally would. Depression also affects one's energy level. Even doing little things can make someone feel exhausted. There may also be a sense of worthlessness or excessive guilt. For example, your teen might make self-deprecating statements such as, "I'm no good," "I can't do anything right," "Everything is my fault." Depression can also affect their cognitive abilities, for example, decision-making or concentration. Even seemingly simple decisions, such as what outfit to wear or what plans to make over the weekend, might be overwhelming to someone with depression. Your teen might not be able to concentrate on schoolwork, or might even struggle with such basic things as having a coherent conversation. Lastly, thoughts of suicide can sometimes emerge, especially if depression has gone on for a long time, and even more so if it goes untreated. An untreated depressive episode can last as long as 7 to 9 months, potentially an entire academic year. Think of the social, emotional, and academic learning that could be lost, knowing that depression affects all parts of someone's life, if they have depression and are not getting treated for it. It's also noteworthy that 90% of people who die by suicide have a diagnosable mental disorder, most commonly depression and/or a substance disorder at the time of their death. So logic speaks to the fact that the best way to prevent suicide in your teen is to identify mental health concerns like depression as early as possible and get them linked to vital treatment and services. The goal is obviously to identify warning signs for depression as early as possible and not wait until your child has full-blown depression before seeking help. These are additional warning signs to be aware of. We have already talked about several of them. However, I would like to highlight a few. We know that many teens may experiment with drugs and alcohol, and certainly you should talk to them about the dangers of even experimentation. But particular red flags to look for are if they are using drugs alone, during the day, or to cope with difficult feelings. You should also be on the lookout for risk-taking behaviors, or if your teen is putting themselves in dangerous situations on purpose. For example, picking fights, climbing too high on the playground, shoplifting, getting into cars with people who've been drinking, or being promiscuous. A drop in your teen's grades can also be an indication that they are struggling with depression. Even subtle changes, like your child not spending as much time on homework as they used to, not seeming as engaged in school or learning, could indicate possible depression. Finally, when it comes to depression, you're looking for a significant personality change. Your teen just doesn't seem like himself or herself, or is behaving very differently from how they would normally act. I want to switch gears now and talk about what causes a suicide. Whenever there's a suicide, the first question people ask is why? Why did they do this? Why did this happen? How could this happen? Rarely, however, is there just one cause or reason. In the majority of cases, suicide is the result of a combination of different risk factors in the presence of one or more precipitating life events. A risk factor is any environmental trait or personal quality that's associated with suicide. A precipitating event, on the other hand, is that trigger we often hear about when suicides are reported in the media. For example, bullying, a breakup, sudden death of a loved one, getting suspended from school, struggling with sexual orientation. Typically, multiple risk factors in conjunction with one or more triggers are involved. It's also important to understand that people who contemplate suicide in most cases do not want to die. They're just looking for a way to escape the insurmountable pain that they are experiencing. The illness of depression causes them to have tunnel vision, and they can see no other solution to their problem other than suicide. Before I talk about the specific risk factors for youth suicide, I want to first point out something important about normal adolescent brain development and how this, in combination with depression, can contribute to suicidal thoughts and behavior. The brain of an adolescent looks very different from an adult brain, as the brain does not fully form until someone's in their mid to late 20s. The last part of the brain to mature is the frontal lobe. This is the part of the brain responsible for reasoning, controlling impulses, and planning ahead. As a result, teens can't think through problems in a complex way. They're impulsive. They live in the here and now. That's why something like failing a big test at school, a fight with friends, or a breakup can be such a big deal to them. They're not able to think through the fact that they'll do better on the next test, that their friends will get over it, or that they'll have a new relationship later. They're only focused on how they feel in that moment. When you couple this normal brain development with depression, it helps you understand why suicide might appear to be a viable solution to a problem. The three leading risk factors for suicide in youth are depressive disorders, alcohol and substance abuse, and previous suicide attempts. Self-injury is when someone intentionally and repeatedly harms themselves, for example, through cutting or burning. 15 to 20% of teens self-injure at some point in their lives. When someone self-injures, it's not that they're trying to kill themselves, but rather that they're trying to deal with difficult feelings, such as anxiety, sadness, fear, anger, or shame. Clearly, this is an ineffective means of coping. A person who is self-harming needs help immediately because self-injury can lead to a suicide attempt if untreated. The emotions and feelings build up over time and can lead to depression and thoughts of suicide. Anxiety disorders are common mental illnesses characterized by feelings of extreme uneasiness, worry, and/or fear. A person with an anxiety disorder feels an inappropriate amount of anxiety more often than is reasonable. Nearly 1/2 of those diagnosed with an anxiety disorder are also diagnosed with depression. If your teen is exhibiting signs of anxiety or depression, treatment is essential. It's also important to take note of the fact that your teen's personality can potentially influence the risk for suicide. A young person, for example, who by nature is impulsive, aggressive, has poor self-esteem, and/or poor problem-solving skills, is at an increased risk for suicide. Furthermore, if your teen is lacking in social skills or purposely isolates themselves from peers, they're also at increased risk. Negative life experiences also impact one's risk for suicide. For example, someone whom is extensively bullied, someone who experienced the loss of a family member, someone whom endured a sexual assault or other trauma. As we're talking about these different risk factors, keep in mind that in most cases, multiple risk factors are involved when someone is at the point of contemplating suicide. Elyssa, for example, was sexually assaulted by a family friend when she was 12 years old. She was subsequently diagnosed with PTSD and later depression. She was bullied off and on throughout junior high and high school. So there were a number of risk factors at play. There's also a genetic component to depression. Depression is an illness, just like other illnesses such as heart disease or diabetes. If someone in the family has had it, especially if it's a parent or sibling, others are at an increased risk. A death by suicide in the family also elevates this risk for other family members. Family stressors are yet another risk factor. Things like a divorce, trouble with finances, a parent who's incarcerated, a parent who has a chronic illness. Think about how difficult these things would be for you as an adult. And now imagine how your teen might be struggling to cope. Stigma is yet another concern. For some people, getting help for a mental illness is a sign of weakness. For others, it contradicts with their religious beliefs. When parents are in denial of their child's mental illness, it can prevent them from getting the critical care that they need. Once again, depression is a medical illness, just like diabetes or asthma, and it requires treatment. Finally, lethal means. Firearms are used more than any other means for suicide, and they are the most lethal. Guns in the home increase the risk for suicide whether someone has a mental disorder or not. Excessive alcohol use is a contributor to this. If your teen is having a mental health crisis, remove guns from the home. If this is not an option, firearms should be stored separately from ammunition, and both should be kept in separate, locked compartments. One other risk factor that is significant is teens that identify as LGBTQ+, lesbian, gay, bisexual, transgender, queer/questioning, and the plus is basically any other way that individuals identify themselves other than heterosexual. Teens who identify as LGBTQ+ are 4 times more likely to attempt suicide compared to their peers who identify as straight. Furthermore, if they've come out to friends and family and are not accepted, they're 8 times as likely to attempt suicide compared to LGBTQ+ teens who are accepted. In addition, the majority of LGBTQ+ teens report being harassed at school and feeling unsafe. Youth who identify as LGBTQ+ are also at increased risk for drug abuse, dating violence, sexual assault, and eating disorders, things that in and of themselves are risk factors for suicide. If your teen or one of your teen's friends has identified in this way, or if you suspect that they're struggling with their sexual identity, the more communicative and supportive you can be with them, the better, especially if other risk factors are evident. We know that this lack of acceptance can have dramatic negative effects on teens' mental health. If you are struggling to accept your teen, it's critical for their safety that you seek professional help for yourself. We talked about depression. We talked about the fact that multiple symptoms over a period of time of 2 weeks or longer must be present for someone to receive that diagnosis. These next things would need to only happen once to warrant your immediate concern and action. The first is talking or writing about suicide or death. If someone talks about killing themselves, either directly, for example, I want to die, or indirectly, for example, my family would be better off without me, you always want to take that extremely seriously. This could also include written statements, either in a note, an email, a text, a post. Whether someone says it or writes it, it means they're thinking about it. You never should assume they're just joking or being dramatic or attention-seeking. Another critical sign is someone neglecting appearance or hygiene, especially if they previously cared about and spent time on how they looked. For example, someone who's not showering, wearing the same clothes several days in a row. Girls no longer wearing makeup or doing their hair like they used to. Other serious signs include isolating from friends and family, obtaining a weapon or other means of self-harm, and giving away prized possessions. This last one might look like someone putting their affairs in order. For example, at a middle school we work with, a student put goodbye notes in all of her friends' lockers. Luckily, they knew to come forward, and she got the help that she needed. Similarly, at a high school we work with, a student texted a friend with instructions on where to give away his belongings, as well as provided all of his computer passwords. Luckily, his friend came forward, and this student also received immediate help. One last noteworthy sign is someone who exhibits a sudden and unexplained improvement in mood, especially after a significant amount of time of seeming very down or depressed. While you might assume this is a good thing and think perhaps that they're getting better, it could indicate just the opposite. People who contemplate suicide in most cases do not want to die. They're just looking for a way to escape the insurmountable pain that they're experiencing. If that person then identifies a means to end that pain, for example, coming up with a plan to take their life, they often feel a sense of relief. This relief may manifest itself as happiness, or they might suddenly seem like they have a ton of energy. If you observe this sudden change, especially in someone with known depression, you need to take it extremely seriously and take action right away. We'll talk more about what this action looks like shortly. And at this time, I'd like to introduce my colleague, Katie Baker, who's going to continue the presentation from here.
Great, thanks so much, Jody, for all of that great information. The great news is that even when someone has risk factors, if protective factors are present, they can reduce the risk of suicidal behavior. Protective factors are personal traits or things in someone's environment that can reduce one's risk for suicide. We talked earlier about how a young person's personality style can increase their risk for suicide. For example, someone who is isolated, has poor self-esteem and poor problem-solving skills is at an increased risk for suicide. On the flip side, when someone has high self-esteem, good coping skills, seeks help when needed, is open to new knowledge, their risk for suicide is reduced. It is so important for kids to have healthy, loving, supportive relationships with family members in the home. Family connectedness is actually the #1 protective factor against suicidal behavior. So even if things aren't going well at school for the teen, for example, they don't feel like they really fit in or they're not getting good grades, if they can come home to a loving and supportive environment, it can truly act as a buffer and protective factor against suicidal behavior. We talked earlier about the impact upon LGBTQ+ teens whom do not have acceptance from parents and how much that impacts them. That acceptance from parents for all teens is so very important. Social connection with peers inside and outside of school is a key protective factor against suicide. The more enmeshed a youth is in different activities, both inside and outside of school, such as sports, clubs, religious youth groups, etc., the less likely they are to make a suicide attempt. As a parent, you want to make sure your teen isn't sitting at home all the time or spending excessive time on the computer or in front of the TV. We also know that one of the most significant protective factors for youth is a caring relationship with an adult. That could be someone in the home, such as a parent, an aunt and uncle, a grandparent, but also a teacher or another adult in their lives, for example, a coach or a club leader. You just heard about protective factors for suicide. Now let's talk about steps you are already taking and can further take as parents to reduce your child's risk for suicidal behavior. We all know how important it is to have regular check-ins with our children. We are busy, our teens are busy. But this could be as simple as having a conversation in the car on the way to school or sports practice, or making time before bed. Sometimes we stop asking our teens about school or about their day because we anticipate getting one-word answers. Good, fine. That may very well be all that we get, but we still need to ask. Teens acknowledge when you are showing that care and concern, and it's important to them, even if they don't show it. It is also important to get to know your teen's friends and ideally their friends' parents as well. You want to know where they are spending their time and if it is a safe, structured environment. Monitoring their schoolwork is also very important. If you are concerned about your teen, especially if they are acting very differently, it is okay to look at their personal materials and writings. They may not like it, but it can give you good insight into what is going on with them. Teachers generally know to report concerns that emerge in students' writings, especially if students are writing about suicide or wanting to die. That being said, as a parent, you want to also be looking for themes of death, hopelessness, and despair, as that too could indicate possible depression or suicidal thinking. Next, I want to talk about internet safety and social media use. We could do a whole training on these topics alone. Briefly, as parents, we want you to be aware of what your teens are doing online. There is a great resource on our handout called netsmarts.org that provides tips on internet safety as well as discussion starters. With regard to social media, it's important to know that there is a correlation between social media use and depression. The more time your teen spends on social media, the greater the likelihood of them becoming depressed. There is also an inverse relationship between social media use and sleep. The more time on social media, the less sleep they are getting, which in turn affects mental health. So as parents, minimally, we want to be aware of what our teens are doing on social media, as well as monitoring their usage. As parents, you are paying the phone bill. As such, you have a right to look at your teens' phones. That doesn't mean that you should be reading all of their texts or looking at all of their posts. That is not only invasive, but also unrealistic. That being said, you can and should look at their phone from time to time and let your teen know you will be doing so. That way, you can make sure that they are being safe themselves in their posts and also see what others are writing to and about them. In addition, if your teen knows you will be doing this, they will be that much more cognizant of what they are posting and thereby safer. You also want to be limiting your teen's usage. A good rule of thumb is to have a cutoff time each night, 9 o'clock for example, where they charge their phone for the night in the kitchen or some other common location that is not their bedroom. That way they won't be on their phone all night, checking their status, seeing how many likes they got. Another part of being proactive is ensuring that your home is safe and removing lethal means as much as possible. Specifically, you want to remove firearms, bottles of pills, and even alcohol, as it can be used to self-medicate and make the individual more impulsive. While your main focus is understandably your own teen, you may be the first to notice warning signs in, in one of your child's friends, or your child may come to you to report concerns about a friend. In this situation, it is important that you convey these concerns to their parents. If it were the other way around, you would want that other parent to inform you. That being said, this is understandably not an easy conversation to have with someone, especially if you don't know them very well. In the event of an emergency situation, however, you need to call the other parent right away and state your concerns as directly as possible. This would be the case if any of the critical warning signs we discussed are present. The parent might get mad, they might get defensive, they might even dismiss your concerns or deny that there is a problem. These are normal reactions, and you shouldn't take it personally. Your goal is to keep this other child safe. So if you don't feel that the other parent really heard your concerns, then you need to call 911 and request a wellness check. If it's a non-emergency, for example, the teen is exhibiting signs of depression but not suicide, then it's still recommended that you call the parent. If you don't feel comfortable, or if you call and they are not receptive, then minimally you need to call the teen's school and report your concerns. The social worker or counselor can then follow up with the student and reach out to the parent as well. Whether you are worried about another teen or your own, the key is not to wait. With your own child in particular, if you notice any signs at all, even if they are not critical signs, you still should take action. Don't wait for them to become suicidal before you get them to treatment. As we just mentioned, having regular check-ins with your teen is so important, even if you are not observing signs of depression and/or suicide. That being said, if you are observing signs, it is even more critical that you talk to your teen about your concerns. Keep in mind that if it's not an emergency, don't force the issue if they don't want to talk or cut you off in the middle. These kinds of conversations can be overwhelming for teens. It's okay to let them know that you want to talk to them, that you are there to listen, and that it's okay to continue the conversation later. In emergency situations, you would get someone else involved anyway, for example, by seeking a mental health assessment. When you do start that conversation, make sure it is in a private setting away from siblings. Mentally prepare yourself for the conversation and remember to remain calm. If your emotions escalate, imagine how your teen will react, and the conversation will end then and there. Listen without interrupting or judging. The best thing that you can do is just listen. In order to convey your concern, let them know the warning signs that you are seeing in them. For example, I've been seeing you cry a lot more lately. You aren't hanging out with your friends and you seem really unhappy. I'm worried about you. Keep in mind that it's okay to ask your child if they are feeling suicidal or thinking about killing themselves. You might say, "Are you thinking about suicide?" Or, "Have you ever thought about killing yourself?" This will not put the idea in their mind. If you are thinking that this is a possibility, then know that they have probably already thought about it. Asking lets them know they can talk to you about this. If they do confide that they are suicidal, do not leave them alone. Finally, reassure them that help is available and you are there to make sure they get the help that they need. In the event that your teen is actively suicidal, seek outside support immediately. Your child might tell you something that doesn't seem to be a big deal in the grand scheme of things. For example, not being included in plans with friends, someone making a mean comment about what they're wearing. But remember, this may be a big deal to them. It's normal to want to tell them something like, "Well, don't worry about that. You have plenty of other friends," or "just ignore it." But that does not let them know that you are there for them and concerned. Along the same lines, if your child tells you that they have thought about suicide, it's normal to be frightened, and a knee-jerk reaction could be to say, "How could you feel that way? I give you so much," or "You have so much going for you." Rather, reassure them that they can get help and that they will not feel this way forever. So if you are having concerns about your child, how do you know when to get them help? If you are observing any suicidal thoughts, behaviors, or talk, any of those critical signs of suicide that we talked about, it is important to seek help immediately. In other cases, you want to seek help when other signs last for 2 weeks or more, and/or when mood or behavior interferes with your teen's ability to function, as this could indicate possible depression. That being said, your child doesn't have to be clinically depressed or have any diagnosable illness for that matter in order to warrant mental health treatment. Other examples of when you might seek outside support are to help your child cope with a divorce or loss, or to bolster coping or anger management skills. The following are examples of what treatment for depression for your child might look like. Talk therapy or counseling is often the initial step of treatment. Medication is also an option, albeit a scary one for many parents. In large-scale randomized studies that have been done on adolescent depression, medication does show a clinically statistic effect. There is lots of evidence showing the efficacy of medication, and in fact, it is the standard of care for moderate to severe depression. That being said, the best results occur when a combination of therapy and medication is applied. If your teen is on medication, it is critical that you monitor them for any potential side effects. Also keep in mind that it takes a minimum of 2 weeks for medications to build up in the body and take effect, so don't expect any immediate improvements. There are also things that you can do at home to assist with treatment. We discussed earlier how sleep, eating, and activity level are all impacted when one has depression. The more you can do to bolster healthy habits in these areas, and the more you can encourage adequate sleep and healthy diet, the better. For example, taking your teen's phone away at a certain point each night and not allowing it in the bedroom, setting a regular bedtime, or at least a time when they go to their room each night, ensuring as much as possible that your teen has regular meal times and isn't skipping meals or compulsively snacking, and encouraging exercise. At least 30 minutes daily is recommended to help minimize symptoms of depression. Finally, hospitalization, while certainly a last resort, is a needed step in the event that your teen is actively suicidal. A hospital setting offers a safe and controlled environment where a teen can get the intensive services that they need to help stabilize them. The average stay is 7 to 10 days at the most. The goal is to get them stabilized and then get them released. Often, they will transition them out with intensive outpatient services, which is typically daily therapy to start. In all cases, it is important that you identify a school advocate that can help facilitate the transition back to school. If you think your teen needs counseling, contacting your pediatrician or school are the best places to start. Friends, relatives, and word of mouth is also helpful. If you are comfortable enough to broach your concerns with others, you will likely be surprised to find out how many others in your circle have sought or are seeking support for mental health issues, either for themselves or for family members. If you are uncomfortable talking directly to anyone, you can always contact the Suicide Prevention Hotline, 24 hours a day, 7 days a week, for anonymous support. A crisis counselor will speak with you and get you and your child connected to help in your area. Finally, if you are worried that your child is suicidal, especially if they have a suicide plan in place, call 911 or go to the nearest ER. This is because they need to have an evaluation done to determine their level of risk for suicide and what the next treatment step should be. If your child has made a suicide attempt, take them to the nearest ER so that they can get any required medical attention. If they have not made an actual attempt but have thoughts, then take them to the nearest behavioral health hospital, which might not necessarily be the nearest ER. The advantages of going to a behavioral health hospital in this situation is that number one, there will be less wait time than a traditional ER, and number two, since not every hospital has a psychiatric facility, you can avoid your child needing to later be transferred. When it comes time to set up that intake appointment for non-emergency situations, it is normal to feel intimidated and to have mixed feelings. You want your teen to be okay, and you may find yourself coming up with reasons why they don't need treatment after all. The following are some of the most common objections parents have to seeking treatment for their teen's mental illness, as well as the reasons why they need to do it anyway. So you may think to yourself, I'll wait until they outgrow this phase. But really, they need medical attention, not time. You may think, I don't want to label my child. But you would seek help for other medical conditions regardless of implications. You might think my teen refuses to see someone, or my teen will be mad at me. Your teen's objection would not stop you from taking them to the doctor regarding a physical condition. It's your role to keep your child healthy and safe. You might think, I don't know where to go. Ask a school counselor, your child's pediatrician, and others discussed earlier. You might think, I don't want my child to take medication. I heard it is dangerous. It has side effects and hasn't been tested. We know that antidepressant medications have been tested. Teens and parents should monitor mood and symptoms for positive effects and side effects. So if you have mixed feelings about seeking treatment, you can only imagine how your teen will feel. They will likely be scared, especially if they don't know what to expect. and that fear will likely come across as resistance or even anger. It's important to be able to respond to their concerns in a calm and straightforward manner. So your teen might say, "I can handle this myself," or "this will go away on its own." Your reply to that could be, "You are strong, and this is a medical condition that needs attention from a doctor, not time." Your teen might say, "I'm not crazy." And you could say, "That's true. You have a medical condition that can be treated so you can feel better." Your teen might say, "I don't want to be locked up in a hospital." Your reply could be, "Most people with depression don't need to be in the hospital because there are effective ways to treat depression." Your teen might say, "I don't want to take medications." You could say, "We don't know if medications are necessary, but if they are, we know that they are safe and you will feel better." Your teen might say, "I don't want to talk about this." And you can say, "I understand if you are uncomfortable. It's my job to keep you safe and healthy and to get you the medical care you deserve." Next, we want to talk very briefly about the SOS Signs of Suicide program that Elyssa's Mission funds and implements in Chicagoland schools. SOS is a national program that was developed by an organization in Massachusetts called Screening for Mental Health. The program was developed by mental health professionals, it's evidence-based, and has been tested for safe messaging. If you heard about this presentation from your child's school, that means we are already working with them. If not, then you certainly want to check with the school to determine what preventative programming, if any, is currently in place. It is vital that schools are doing something. The reason that Elyssa's Mission chose to endorse this specific program is because it is the only comprehensive school-based program that has been shown to reduce suicide attempts by 40 to 64%. The SOS program can be implemented in just one class period. There is a separate video for middle schools and high schools, though the program goals and core messaging for both age groups is the same. Through the program, students learn the warning sign for depression and suicide, that depression is a treatable illness, and that suicide is typically the result of untreated depression. Students learn that depression and signs of suicide are not things that they can fix on their own. They are taught that the best way to help themselves or a friend who may be at risk is to act, acknowledge, care, and tell a trusted adult. After the video and discussion, students fill out the brief screen for adolescent depression, which includes 7 yes or no questions that touch on potential symptoms of depression. 2 of these questions ask about suicidal thoughts and behavior. The screener in no way diagnoses depression or suicidality. It merely alerts school mental health staff to those students in need of further investigation. Students flagged by the screener or requesting to talk with school mental health staff receive a follow-up interview to determine next steps, if any. Parents are notified if their child receives an interview and if any referrals are warranted. To learn more about the program or to learn more about suicide prevention in general, please visit our website. There is a section designated specifically for parents. There will be a link to this helpful video created by the Mayo Clinic underneath the link to the presentation you just viewed. In it, you will hear from real teens about how you can best talk to your teen about any concerns. It's a great review of what we just talked about. We encourage you to watch it at your leisure. Do not hesitate to contact us at any time with any questions or if you would like more information about how to bring the SOS program to your child's school. Thank you for listening and for making suicide prevention a priority for your family.